The 2009 Wharton India Economic Forum, titled India, The Road Ahead, took place in Philadelphia and brought together CEOs of leading Indian companies, investors, heads of non-profit organizations, sports celebrities, and Bollywood stars to discuss where India is headed in an age of economic uncertainty. Indian Knowledge at Wharton brings you one-on-one conversations with these leaders.
Thanks very much for joining us today. Apollo is Asia's largest healthcare provider. Can you give us a sense of its scope of operations?
Whenever we take stock, there's always something new. But broadly, we're in hospitals, tertiary care. Owned and managed, we have about 42. We have 8,500 plus beds, 60,000 employees. Apart from hospitals, we're in retail pharmacies. We have 900 pharmacies today. We should finish by June, or well before June, we'll have 1,000 pharmacies. We open one a day. That's the kind of count we've been doing for the last 2 years now. And we have clinics. We have a BPO, an IT business processing. I think the headquarters is actually quite close to Philadelphia. And health insurance, we have a new company. It's about 1.5 years old. It's a joint venture with Munich Re, which is the world's largest reinsurance company. And that's a new initiative of ours. Apart from that, we have several other businesses. We're incubating the health highway. We have an ambulance service. We do a lot of insurance for the underprivileged in rural areas, where we manage the health insurance programs for them. And
can you explain what the health highway is?
Health highway is a new project with IBM that as the technology provider, where we're creating a linkage between hospitals, irrespective, not just ours, but hospitals across India, and also doctors, where patients' records that could vest on the highway, and right from all aspects of information technology, whether it's managing a hospital, managing the procurement, or even finding resources in terms of human resources, many, many things. And this is what it would provide: scientific information, teleradiology, telemedicine. Everything would be part of the highway initiative.
And this would reach into rural areas?
Definitely. We're already quite robust, the network we have.
What would you say are the major problems with medical infrastructure in India today that have yet to be overcome?
The short answer is that there's a huge supply shortage of quality beds. You know, it's a little skewed. You would find beds and lots of competition in cities, in urban areas. And that's why Apollo's moving to tier 2 cities, where we're establishing, again, tertiary care hospitals. We think that there's a lot of growth, and the rural population can afford good quality medicine. And I think that supply. So it's going to take $1 trillion of public and private money over the next 10 years to even try and catch up to what the public actually needs. And the other day I read a statistic. See, Indians are actually clinically proven that, they're prone to heart disease. And unfortunately, we've been tagged as the diabetes capital of the world. Nearly 12% have are discovered diabetics. And they're saying that the cost of preventive medicine by 2015 is going to be around $50 billion. I read that statistic. We're seeing it happening. It's quite frightening.
Now, with a lot of the technological advances, both medical and informational, that are happening, and some of which you cited, what do you see taking shape, or how do you see the landscape transforming over the next few years in India, vis-a-vis some of those technologies?
I think that I can talk for our hospitals, that we've always been very technologically advanced. in fact, the cyber knife, Dr. Adler, who discovered it, who was the inventor, he was in India last week, and we bought the first cyber knife in the region, 360 slice CT. Where you do
a
angios.
cyber knife is what?
A cyber knife is what they use advanced radiology for cancer treatment. There are very few in the world, and what it does is that it's so much more precise, and the radiation used is 1/10 of what a normal machine uses. So we have a PET CT in our hospitals. So we've always believed in technology. Right from our first hospital when we opened in 1982, we had the first CAT scan in the country. And we continue to do that because we think it plays an important role. If you look at Indian medicine, I think there were some doctors from the US that came to us, and they were actually shocked that 95% of our cases, of our open heart surgery cases, are done with a beating heart. So, that's cutting edge technology. In the US, they probably use that technology for maybe 50 to 60%. And so I think that India, and by and large, Indian doctors are well known. We've been fortunate to have a lot of them come back. So one, it's technology, and two, it's the ability to harness the people with the talent who can do that. And India is definitely proving itself as a center for that excellence.
And so you're definitely seeing a higher number of doctors coming back after their medical training to India than before?
I would think so, because every new hospital that we open, we have quite a few applicants, especially, not as many from the US, but definitely from England and other parts where, and most of these are Indians, but surprisingly, we have one or two expats also working with us.
Right. Now, you mentioned your first hospital in 1982. That was in Chennai, correct?
Correct.
And it was a 150-bed hospital, I believe. And to what do you attribute Apollo's phenomenal growth over the years? That's not a very long period of time. It was 1982, and to go from 150 beds to what you are today. What's helped Apollo to grow so quickly?
I think that this great growth has actually been over the last 10 years. We had the advantage of the previous 15 years to prove, test, and get the model right. Because at every time, I think we believed in the fact that the quality and the patient service outcomes are just critical in Apollo. If you see that you match us anywhere, whether it's an open heart or even a liver transplant, we have world-class outcomes in all our hospitals. I think the focus on that has helped us grow, and for people to have the confidence in us. The phenomenal growth over the last 10 years in many of these sectors, I think, has been the ability to access capital much easier. And the fact that, we have 2 or 3 levels of management who had grown with us and who were able to take over the mantle to move into new projects and just move it. Right from doctors to nurses to management, personnel, all fields, that they were able to take that through. And I think that's a great combination.
Well, with world-class facilities and the level, the success of the outcomes that you've cited, I imagine the one thing that might hamper Apollo would be perhaps the actual infrastructure in the country. And globally, you compete with hospitals from Thailand, for instance, where infrastructure isn't so much of an issue. People can sort of fly in very easily, get to where they need to go. How does Apollo compete in that particular scenario?
15% of all our major hospitals have international patients with us. The patients, a lot of them, what Thailand doesn't see, are for higher end treatments. And I think they come because of the quality of the outcomes. We do, our doctors in Chennai, for instance, have done the largest number of cementless hip replacements in the world. So people will come from the US and Canada for them. Thailand is for the regular type of where there's a cost arbitrage. But they come to India for open heart and for the more difficult surgeries. And when it comes to infrastructure, your answer to that, there's very little I can say in India's defense, except the fact that I think we've been able to overcome that within our little island of a hospital.
Sure.
But we can't take it outside. But the government has now understood. They've gone to Thailand. Everybody studied Thailand as a model in the whole region. Singapore has, Malaysia. Everybody's trying to replicate that model effectively. And I think that the numbers are telling in the region that it's not just Thailand that dominates, but the other hospitals in the whole region are benefiting from opening this sector up.
And do you see improvements in infrastructure that are either happening now or that are planned that you think will sort of help to improve the situation?
Connectivity, yes. You know, they've privatized airports in India. We have 3 of our major airports are private, 4. And I think that there's been a sea change in the number of flights that come in, the connectivity. In terms of roads, India has embarked, not maybe the scale of China, but what the US did in the 50s and 60s during the Great Depression. I think that we have, we're investing in a larger network of roads than that. So I think that all these will tell. We still have issues in terms of electricity, but I think it doesn't really affect a hospital as much as it does, you know, a state problem.
And do you think that despite these difficulties, that perhaps there's been a benefit to innovation in medicine in India? In other words, because there are infrastructure issues to overcome, you have you know, a rapid adoption of telediagnostics or teleradiology, which I think you mentioned earlier.
I think that that's a really good observation, that possibly this advancement that we had in, you know, in telemedicine is probably is in response to a need. So we actually have diagnostic vans which have satellite connectivity with the ISRO, that's the Indian Space Research. So they've given us the ability with the satellite, and we go into the rural areas, remote areas where we're able to do, you know, diagnose people with heart or ailments, do the ultrasounds and the X-rays, and it gets beamed into our main hospitals. So, and this is on a moving vans. So I think that, yeah, the innovation has been there in response to a need. We use telemedicine extensively. After the tsunami, we had an outpost in Andamans. That's the island that got hit. It was completely submerged. The first thing that the government put up, got linked up again, was our telemedicine network station. And so we were doing consults across the ocean into this area, and I think that was it was a huge need that was served.
It's remarkable. Well, you've been branching into retail pharmaceuticals and into health insurance as well. Where do you see Apollo 5 years down the road, or maybe even 10 years, in terms of its strategy and how it's developing?
I think it was probably, you know, India is such a nascent country in terms of healthcare that that at the beginning we provided every need. It's like the Wild West. You put your stakes in every part of healthcare. But I think that there are enough players coming in and competition coming in that we have to choose which are the areas that we will continue to dominate and be really good at. And some of these have been, and some of this is definitely health insurance, where we feel that access for people is going to come from there. There's only the need in India is probably the size of the US population. The 300 million people who can afford health insurance, so we just need to be able to make them aware and sell that. Big one. For us, hospitals will always remain the core of our business. Diagnostic centers. I think the pharmacies are a means to an end. We got into the retail space. We're quite good at it. We have 1,000, and the very fact that next year that project will break even and start doing well. So there's definitely strength in that. And we'll continue to find we might expand across our own geographic border into other markets.